Good morning, good afternoon, and good evening to everyone from around the world. My name is Sam Macau, Policy and Advocacy Officer at Wake Health, and welcome to another session of VUCA Show. These are 15-minute conversations that we are having daily across the continent to highlight the importance of increasing our contributions to the Global Fund and successfully replenishing it this year. Now, today we have an amazing list of guests on the show, and we are in Rwanda. I would like my guests to quickly introduce themselves, and I will start with Brice Galikan and then Mr. Manzi, and we'll kick off our conversation. Please feel free to talk to us on Facebook or in the chat section on YouTube, and also use the hashtags The Beat Continues, Fight for What Counts, and Meet the Target. Without further ado, let's get into the introductions.
Hi, thank you very much, Sam and colleagues for the invitation. My name is Brice Bambara. I'm an associate specialist in civil society advocacy at the Global Fund to fight HIV, tuberculosis, and malaria. And it's a pleasure to be with you guys. Thank you.
Thank you very much, Sam. My name is Mans Norman, and I'm the director of Dream Village, an organization that supports young people here in Kigali. I'm very happy to have been invited for this session.
Dr. Galika?
Yes, good afternoon. I'm Galikan Rivasira, the head of HIV program in Rwanda. Thank you so much.
All right, thank you. And to start off these conversations, I'd like to welcome Brice to talk about the journey of the Global Fund for the past 20 years, and also to highlight the importance of Rwanda's investment in the Global Fund's 7th replenishment. Welcome, Brice.
All right, thank you very much, Sam. So I'm going to again start by thanking our partner GFAN Africa, along with the Rwanda NGO Forum and our civil society and community partners for their commitment and the fire in the fight against HIV, tuberculosis, and malaria. With less than 2 weeks left to the Global Fund 7 replenishment, we need your voices more than ever. And I would also like to express our sincere gratitude to the government of Rwanda for being a champion for the Global Fund replenishment, and also for their leadership in using innovative approaches to building and strengthening resilient and sustainable system for health. So in terms of the journey of the Global Fund for the past 20 years, as most of you know, the Global Fund was created as a result of a UN General Assembly first special session on HIV and AIDS in June 2001. And it was the very first ever partnership between government, community, civil society, technical partners, and the private sector. Since its creation, the Global Fund partnership has saved 44 million lives, reducing the number of deaths caused by HIV, tuberculosis, and malaria by 46% in countries receiving Global Fund investment. On September 18th and 19th of this year, the Global Fund will be hosting its 7th replenishment conference. And we need at least 18 billion US dollars to save an additional 20 million lives. Behind this number, there are people with hopes and dreams, with potential. There are the future heads of states, the future scientists that will find the cure to the future diseases that we will be facing. You know, our partners continue to invest in the Global Fund, as we have shown that we can make remarkable progress against HIV, tuberculosis, and malaria. Unfortunately, the COVID-19 pandemic had a devastating impact on the fight against the 3 diseases in 2020. And for the first time in the Global Fund history, we lost progress in our efforts to defeat the 3 diseases. But the Global Fund partnership took swift action to fight the pandemics and protect hard-won gains. There will be a new report coming out next week that will show that our investments are paying off, that we are regaining the grounds we've lost during the pandemics in the fights against the 3 diseases. It is therefore important for us to continue the fight for what counts. And while we are faced with, many challenges that will make it difficult for us, it does not make it impossible. 3 years ago, with the tremendous leadership of our partners, civil society being at the center, we're able to raise $14 billion. If we did it before, we can do it again. And that's why, it is very important for countries like Rwanda to invest in the Global Fund 7 replenishment. It's been proven that implementing countries have played and continue to play a pivotal role in the impact that the Global Fund has had over the past 20 years. During the sixth replenishment of the Global Fund, the government of Rwanda was a Global Fund champion and pledged the amount of 2.5 US million dollars. This year, the government of Rwanda is again a champion for the Global Fund replenishment. The government of Rwanda has shown important leadership in global health by participating in important health initiatives such as, the vaccine mRNA manufacturing and increasing domestic financing for health. And since 2010, we've observed significant reduction in the HIV disease burden with 56% incidence reduction and 59% mortality reduction. And in TB, there was a both decrease in incidence and mortalities at respectively 4% and 5% respectively per year. With such a great track record, by investing in the Global Fund 7 replenishment, by pledging and also committing to increase domestic resources for health over the course of the next 3 years, the government of Rwanda will send a strong message to both donor and implementing countries, and this will encourage other countries to follow into its footsteps. In the fight for an equitable access to health services, every step counts, and I thank and encourage the government of Rwanda, civil society and community partners, and also the private sector to continue to fight for what counts. Thank you very much.
Thank you so much, Breeze. Absolutely powerful words there. If we did it, we can do it again. And that's true. Thank you. A big thank you to the government of Rwanda for the support that they've shown for the 7th replenishment and even in the 6th replenishment. But to bring this a little bit closer to home, we've gotten the context of the Global Fund from Breeze, and now we want to get some more context from Rwanda. And to that, I would like to welcome Dr. Galikan to talk about the impact of the Global Fund support in the fight to end HIV, TB, and malaria, and in strengthening health systems in Rwanda. Welcome, Dr. Galikan.
Yeah, thank you so much, Sam. I think my colleague has been touched actually more to the impact and Rwanda, as other African countries that have been benefiting this Global Fund support to address burden of malaria, HIV, and TB. I think we are glad to be sharing some good progress that our programs have been achieving in this last almost 20 years of support. So with this partnership that we are happy to record some of the progress that our program, the 3 program to address 3 diseases from whether TB, malaria, and HIV. And specifically, this has been more reported to be the killer disease prior to this partnership with Global Fund. And actually, this is probably paved by some key strong opportunities that our country leadership has managed to invest in managing this funding and support. So one could be probably to share around the political engagement and commitment as well, but also the integration of the disease into the plans and goals and other government priorities. To also note around the strong health system that Rwanda actually with this support managed to build the infrastructure, but also the strong system to even improve on diagnostic, but also treatment and even engaging community for prevention purposes. So we also recorded the available support to support other sectors that could align to curb these diseases, including not only for the health sector, but engaging other sectors that could support into prevention, from nutrition, from SRH, and other community services that need a closer partnership with other sectors. So we have also recorded the greater engagement of the communities. So Rwanda is one of the countries that are closely work with the community to address these diseases. To note that more than 80% of the cases of malaria are closer to 80% are managed, detected, and treated at community level. So to also note that the TB detection and even HIV prevention services, mainly the managed at community level. So engagement of communities has been one of the success parameters that could help Rwanda to address and reduce the burden of HIV, TB, and malaria. So the private sector engagement as well have been one of the key pillars that supported the country to address and to benefit from this global fund support. So, however, we do again need, as my colleague said, to keep raising the voice, and probably during this period that we have been experiencing the fragility of our health system, and COVID has even proven that we need to invest more in building the health system that are strong, but also that are resilient to any other pandemic that could be arising. So we need that engagement more than ever. We need to keep advocating more as beneficiaries. We need to keep raising our voice, but also we need to engage again and more our political leadership to keep supporting this replenishment, but also to keep mobilizing more other engagement to other sectors that could help to support in this time around to sustain that have been achieved, but also to think about the possible sustainability of these diseases management. So we need to keep investing more in sustainability. We need to build the strong communities that are able and owning the program. But also we need to really think investing in more technologies and probably transferring the technology from these Western countries to be executed and make a full of practice in our continents. So that's why we think that Rwanda would be probably the hub of these technologies. We talked about vaccine manufacturing, and we keep that these technology transfers will be manufactured in this continent where the burden of disease is and has been happening. So we think this replenishment would be a success for our country, that managed to be a model country that have been showing to be effectively use this funding to curb the burden of this disease. But also we need to really keep raising the voice from the communities, from the beneficiaries, and we need that voice coming from the beneficiaries saying that this is where we have been and this is where we are, and we need to be moving to this point to the next level that we think we need to close the gap to address these diseases, whether from HIV and TB. So if we say about sustainability and probably elimination and ending AIDS by the next 9 years, and we think that commitment and government involvement to this replenishment would be one step toward that target we are talking about. So I take this opportunity to thank all actors that have been engaging in this replenishment, including the platform like this. And we ensure that our voice from the beneficiaries, from the government perspective, will keep raised to keep and looking forward to the successful replenishment to this time around. Thank you so much.
Thank you so much, Dr. Galikan. Quite important points there, but I think one of the major takeaway points from your intervention is that there is need for strong government leadership in order for us to achieve our targets. And through their support, then we can be able to build stronger and resilient and sustainable health systems. I'd also like to recognize the people from around the continent and around the world who are watching us. Just to mention a few, we have CG, Olaide, Rhoda, Caliste. Thank you so much for joining. We appreciate you taking the time to be part of this. And as now we are tying this conversation up just a little bit more, we've had the global context for the Global Fund replenishment, and we have seen the impact that the Global Fund has had in Rwanda. Now we want to talk about the role of communities, because at the end of the day, everything that we do is for the communities. I'd like to welcome Mr. Manzi, who'll talk about the role of civil society and young people engagement within the Global Fund processes. Welcome, Mr. Manzi.
Thank you so much, Sam. First and foremost, we have to understand that for a health system to succeed, there should be a vibrant and supported civil society. Civil society, we believe they are the voices of the people. They are on the ground, on the grassroots, and they interact with communities. And then in most cases, they are the ones who are even able to bring evidence. When you talk about data, when you talk about evidence in terms of planning, they are the people that could really be the eyes, for instance, for development partners and the government. So without a well-supported civil society, everything that is geared to meeting the needs of the community in terms of health could not be there. And when I rate it in terms of the youth, it's now that we have to stop talking about youth as numbers. We have to start looking at youth as people who matter and who come first. And then when we talk about planning in anything, let's talk about the Global Fund, for instance, processes, without involving in the youth in planning, in implementation and monitoring, it means we are leaving out a big number of people who make up the biggest percentage in the country and even global-wise. So the youth should be at the round table in planning, both at national, regional, and global level. When we talk about funding the youth-led organizations, since we believe the youth still consist a big number, and then we are always talking about reducing new infections, for instance, about HIV, without involving the youth, would be meeting a dead end. It's time that we started supporting the youth-led organizations, equip them with resources so that they can be able to reach around this number of young people that we are talking about. And then, as we do that, it is the responsibility of every government, every funder, everyone who is interested in addressing challenges in health to allocate resources to these youth organizations. And I believe that as we even talk about ending AIDS by 2030, if the youth are fully involved in the fight, I'm very sure that it will end. So I call upon all partners to rethink again so that they could invest much more than they were doing into youth-led organizations, and together we can continue the fight. I thank you.
Absolutely. We are the generation to end HIV, we are the generation to end TB, and we are the generation to end malaria, because every voice counts, every cent counts, and every life counts. Thank you so much for your interventions. We have come to the end of this show. Thank you so much for joining us from across the continent. We see you from Zambia, Kenya, South Africa, Nigeria. Thank you so much for joining. But just as a last takeaway, I'll give you 30 seconds to give the government of Rwanda a message. I think I'll start with the priest, the good doctor, and we'll finish with Mr. Manzi.
Thank you very much again, Sam. So, as my colleague Linda Mafu would say, we have three options. Option one, get the $18 billion. Option two, get the $18 billion. And option three, guess what it is? Get the $18 billion. And for that to happen, we need, once again, the political commitment and leadership of the government of Rwanda. So I would like then to call on to the government of Rwanda to multiply, the efforts that they're already deploying to make sure that the Global Fund replenishment is a successful replenishment by increasing the contribution to the Global Fund by 30% and by ensuring that more domestic funds are invested in health, and also by rallying other African leaders to the cause. Thank you very much for fighting for what counts, and thank you very much for supporting us to meet the target.
Thank you, Brice. Dr. Galligan?
Yeah, thank you, Sam. And my just word is a word of commitment. Rwanda will still be committed. We are still engaged to support this replenishment, and we're also not far from the cause. We are also ready to fight what is counting.
Thank you so much. Mr. Manzi?
Thank you very much. As our country has always done it, and we can't ask for more, but we request for more increase in domestic funding, and mostly towards the youth-led organizations, so that collectively we can be a big force in the fight. I thank you.
Thank you so much, and thank you for joining us. Please join us tomorrow for more conversations from the Democratic Republic of Congo and from the Senegal. As they say, good things comes in two, and tomorrow we'll have 2 VUCA shows for you. Thank you so much for joining. Please join us on social media with the hashtags The Beat Continues, the hashtags Fight for What Counts, and Meet the Target. Let's keep amplifying and let's keep reaching out. We must meet the target. See you tomorrow. Thank you so much. Bye.